Hello, I'm Instructor Hickman with Modern Warrior School. Today, we're going over third line medical gear. So I've organized my medical gear into two categories: life-saving medical equipment and non-emergency first aid supplies. While IFAK seems to be a catch-all term in the tactical world to be med kits, my IFAK has more in common with a household first aid kit than a tactical trauma kit. My trauma kit, on the other hand, is meant to perform emergency medical interventions using the MARCH algorithm, which stands for massive hemorrhaging, airway, respiration, circulation, and hypothermia. This trauma kit lives inside my backpack, and thus I normally keep it inside a Sea to Summit 2-liter dry sack. The pouch itself is a Maxpedition fatty pouch. On the back, I keep my trauma shears for quick access. On the front, I have a Sharpie for marking tourniquet times and filling out combat casualty cards, and an emergency blanket for dealing with hypothermia and shock. I also keep a small keychain light here for seeing wounds at night and be able to access my supplies a little easier. I also keep a tourniquet. This is a soft T wide in the dry sack as well, directly on top of the pouch. On the inside, I have a nasal pharyngeal airway, straight Kelly clamps, scalpels, and back here I keep my hyphen vent chest seals, wound closure strips, non-stick pads, and surgical pads. Here in the middle I have a couple oral pharyngeal airways, then I have an ACE wrap, regular gauze, and my hemostatic gauze. This is my first aid kit, and like a home first aid kit, it functions like a boo-boo kit, carrying things like bandages, medications, other comfort items, not life-saving medical gear. It does not currently have its own dry sack, but I will be getting a Sea to Summit 1-liter dry sack to put this in. On the outside of the pack, I have a disposable face mask and gloves for PPE, and then diving onto the inside, I have nail clippers, a toothbrush, chapstick, thermometer, and antibiotic ointments behind it. In this pocket, I have assorted bandages and 4x4 gauze. Then in this pocket, I have hand sanitizer wipes and moleskin. Then I have bottles of medications. I have antidiarrheals and antihistamines, and then I have an empty bottle that I normally carry either NSAIDs or antiemetics in. Thanks for watching. If you liked this video, please like and subscribe, and check out our website, modernwarriorschool.com, to stay up to date with all our latest developments.